can people with congenital heart disease who have heart failure live better with heart failure?
Okay, this is a great question. Thank you. I think that the first thing I'm talking to my patients about is let's just move past the deficit narrative. You know, we call it heart failure. There's no getting around it. Our guidelines are based around it. Even our insurance is based around using the term and classifying people as heart failure. But our patients are not failures, and they don't like to be labeled with a term that makes them feel like failures. So I'm really interested in shifting the conversation from failure to function. And I like to start my conversations with my patients asking them, well, what do we have to work with? Because there's two experts at the table here. I might be an expert in congenital heart disease and its management, but you're an expert in living with congenital heart disease and now this new challenge of heart failure. So tell me about your strengths and what you're bringing to the table, because that's a really good place for us to start. And what I'm hearing from my patients is they've actually overcome a lot of challenges in their life. So we talk about resilience. And I know this sounds really vague, but I think if we skip this step when we're managing our heart failure patients, we're really missing an opportunity to build trust and engagement, which is critical. We know that adult congenital patients are often lost to follow-up. Up to 60% of our patients will at some point have a gap in care. And we know when that happens, they're more likely to come back emergently, requiring critical interventions in ICUs and emergency departments. So we've got to engage. Then my conversation shifts to these really simple things. I want you to track your average daily step count. Let's get some facts and let's start talking about what you're achieving and what the goals are. The average American step count is 3,000 to 4,000 steps per day. We want to get people up to 8,000 steps per day. I ask them to track their food over 1 week. Let's talk about Mediterranean diet as a more suitable diet for patients achieving heart health. Let's keep that salt intake low. Let's look for comorbidities that we know are dangerous in heart failure. Sleep apnea is a big one. So we're screening for symptoms, low threshold for doing sleep studies. Let's look at some of those bad habits, alcohol, smoking, substance abuse. It's quite common in our population. And let's treat comorbidities. So there are some patients who do come in with hypertension that needs to be treated. We need to look at their kidney function and so on. And then when it comes to their actual heart failure care, I think that we need to have better systems in place within our network. So this is about system level change, so that we can better partner with people between the visits to track their BNP, to up titrate their medications, to adjust their diuretics, with a focus on feeling better and living longer. That's how I simplify it when I'm speaking to my patients.
Brilliant. Well, thank you, Luke, for that overview of heart failure and congenital heart disease and for taking the time to join us today. For those watching, you can find out more information on congenital heart disease, heart failure and its treatments, and how to live well with heart failure at heartfailurematters.org. Thanks, Luke.
Thanks, Maggie.